Our brains are a big part of how our bodies operate. Both traumatic and non-traumatic injuries can affect how our brains and us function. To explain the difference between these two types of injuries and how they can affect us is Nurse Christina Paris from the VA. So thank you so much for joining us this morning.
Good morning. Glad to be here.
So first off, what is a traumatic brain injury?
So a traumatic brain injury is a direct impact on the brain, usually caused by like car accidents, falling from heights. We see this at the VA quite frequently because we have military members who are in wars, and so they get direct impact from bombs and other things that can occur during that.
And then what's a non-traumatic brain injury?
So a non-traumatic brain injury is something that occurs more, it can be oxygen deprivation or metabolic disorder or illness that can cause the non-traumatic. So it's not caused by a direct impact, yet it still is impactful.
Right.
You know, it really has an impact on people's lives.
Okay. Then what are some of the causes, some more like common causes of non-traumatic brain injury?
So we think of stroke as huge, and I think that was why I kind of wanted to highlight non-traumatic brain injuries, because I think people forget that things like strokes or brain tumors or drug abuse or anoxic brain injuries, that's just not getting oxygen to your brain, that those are brain injuries, you know, and so we have to think of them that way.
Yes, and then what are some of the signs and impairments that can be caused by a brain injury, and then are there anything that's going to differ between a non-traumatic and traumatic?
So I didn't really research those, the differences, and I would think that they would be quite similar. But the thing I really wanted to highlight and focus on is that people who have strokes, it is a non-traumatic, it's a brain injury.
Right.
And so they're gonna have those same movement and sensations, speech, language, eating, swallowing, cognitive difficulties, emotional control is going to be changed. And just bowel and bladder, simple things like that, vision, but thinking and cognition and emotion, I think people don't expect when their loved one has like a stroke or a brain tumor. So I think those are important to highlight and know.
Right. And then is there any like way to like treat these? I know a lot of them like aren't necessarily like reversible, but is there any way to help maybe make these effects less?
Absolutely. So you know, one of the big things we do is medication management for some of these. Physical therapy, speech therapy, and you can even do like occupational therapy, but neuropsychological therapy, that's huge. And I think people forget that, again, that these are brain injuries. Right. But things you can do to also help your loved one would be to keep things kind of quiet and calm at home, reduce any noise or crowded areas, ask your doctor about medications, ask them about therapies. So if you're having these difficulties, if you're finding that you're having outbursts and you were never a person to have outbursts, go and see your provider. Talk to them, because there are things they can do to help you. And just good lighting, you don't want people to fall, we don't want to turn a non-traumatic brain injury into a traumatic brain injury. And modifications in your home can all be helpful.
Awesome. Right. Well, thank you so much for explaining the differences and kind of helping people be a little more aware of how they can also treat those if those were to happen.
Absolutely.
And then coming up, we have What's Trending.